It's a predictable rite of passage. You turn 50, survive lots of over-the-hill jokes, and then the doctor hands you a prescription for a colonoscopy. If you're anything like the more than 20 million adults in this country, your screening appointment is an unchecked box on your to-do list. According to the American Cancer Society, colorectal cancer is the third leading cause of cancer-related deaths in men and women in the United States. The good news is that colorectal cancer has a 90% survival rate when detected in its early stages. Today, a comprehensive guide to colorectal cancer screening options and an in-depth look at an innovative screening option that might just motivate you to get your rear end to the doctor. I'm Erica Vetrini. Access Health starts now. I'm pretty sure nobody likes to hear they need to go in for colon cancer screening. However, for the people who catch their colon cancer early, the consensus is that it's not so bad. We begin with Dr. Perry Picard, professor of radiology from the University of Wisconsin School of Medicine. His work in abdominal imaging has resulted in hundreds of scientific publications.
Colorectal cancer remains a major cancer killer. Up to 140,000 new cases are diagnosed in the U.S. per year. Up to 50,000 people die of this disease, and the real shame of that is it's a largely preventable disease. I think there's a reluctance to come in for a screening exam. I think people feel healthy, why should they bother? But it should be clear that the vast majority of colon cancers affect patients, or at least 3/4, without a family history, and those cancers are lurking without symptoms for often for many years. To get screened is absolutely vital, because that's where we can intervene and either prevent a cancer or cure an early cancer.
Access Health caught up with Dr. Cecilia Brewington, a recognized expert in three-dimensional medical imaging at the University of Texas Southwestern Medical Center in Dallas.
We know how colorectal cancer develops. It starts out, for the most part, as a benign growth called a polyp. And 15 to 20% of us have polyps. If we remove the polyp, you never get the cancer. So our screening tests are built to look for those polyps and then have them removed.
Not all polyps are created equal, and it's really driven by size. Tiny polyps are always benign, and they're like any benign-looking mole on your skin. For example, we would never remove every single mole in every patient. You'd wait until there's a feature that's concerning. Maybe 1 in 1,000 tiny polyps will grow to become a large polyp and cancer. So time is on our side. It takes maybe a decade or more for these polyps to grow to a large size and cancer. So we don't need to be overly aggressive.
Now, there are some of us who are going to be at increased risk for polyps. Those are going to be patients who might have a family history of polyps. If a first-degree relative has a polyp, then there's a higher likelihood that you may also have a polyp. And that means for you, if they have colorectal cancer, you need to screen actually 10 years earlier than when your relative was diagnosed with colorectal cancer. We do see a difference in various ethnic groups in terms of how often they get colorectal cancer. African Americans are the highest risk, and specifically the African American male. They are the #1 race and gender to have colorectal cancer. It means that we recommend they screen earlier. They should screen starting at age 45.
In 2016, the United States Preventive Service Task Force updated its colorectal cancer screening guidelines, adding some new choices aiming to get more Americans screened.
The USPSTF looks at all screening tests and decide if it is an appropriate test to be used across the American population. Well, in June of 2016, they gave several tests a grade A rating. That grade A rating means that this should be a covered service that is offered to patients. What that translates to is that your private insurers must cover this test without out-of-pocket expense.
The USPSTF recommendations break the recommended tests into direct visualization tests versus the stool-based tests. But I think it's important to note that the American Cancer Society guidelines, which came out years earlier, was the first to split these up, but called those direct visualization tests preventive tests, or tests that can detect polyps and cancer, and went on to say that these are the preferred tests because of that prevention benefit.
As Dr. Picard explained, not all tests are created equal. Dr. Brewington breaks down the options for us.
First and foremost, there is the standard, which is called a colonoscopy. That test involves taking a tube and inserting it into the rectum, and that tube has a scope, and this allows us to travel through the colon and see what's there. There is only one other direct visualization test, and that's going to be your CT colonography. That test is a less invasive test. It involves taking pictures of your colon when it's filled with air. We don't travel through the colon with a tube, so that's what makes it less invasive. There are other tests that also received a grade A rating by the United States Preventive Services Task Force. That includes DNA testing. DNA testing is a newer test that is now available that you can do in the comfort of your own home. Another test that you might want to consider is called a FIT test. A FIT test is highly sensitive for detection of human blood that occurs with colorectal cancer.
The stool-based tests essentially try to detect blood or abnormal cells that are sloughed off in the colon, but they both suffer in the fact that they're largely just cancer detection tests. So if that's your goal, say an 85-year-old patient where you really just want to know do they have cancer or not, it might be an appropriate test. For the 50-year-old where prevention is really the greater question, they fall short with that.
Up next, we'll take a closer look at a non-invasive alternative to colonoscopy.
Colorectal cancer isn't something someone in their 20s, 30s, or even 40s generally thinks about, but young onset colorectal cancer affecting anyone under the age of 50 is sadly on the rise. Young people in the prime of their lives are being diagnosed more often and at a later stage than any other group. March is National Colorectal Cancer Awareness Month. To learn more about prevention and screening options, please contact the Colorectal Cancer Alliance at ccalliance.org.
Welcome back. As we just learned, the importance of screening to prevent colorectal cancer can mean the difference between early detection and a diagnosis that could come too late. Joining me on the set today is Art Edmonds, host of Military Makeover on Lifetime. Welcome, Art. I'm so glad you're here.
So great to be here, Erica. I've been waiting to work with you and waiting to talk with you for so long, and thank you for having me.
I heard you've joined the Screenings Club.
Yes.
Yeah, I actually had my first colonoscopy, unfortunately a little early because we have a history of colon cancer in my family.
My mother-in-law had colon cancer, so I'm aware of the benefits of early detection, early screening, and once my doctor said, you know, this was something that I needed to do, I figured I might as well get on it.
So I hear there are two options for preventative screenings, right? Which one did you go for?
Well, you know, we live our lives on camera, right, as TV hosts, so of course I had to take a camera with me for this event to document everything, and I brought some footage.
Well, since I have no family history or other risk factors for colon cancer, my doctor said I have a choice. I can either do a standard colonoscopy, which, you know, is kind of yucky, or a new non-invasive procedure called a virtual colonoscopy. So I'm doing a little bit of homework here to help make my decision. It says a colonoscopy is done as an outpatient procedure under general anesthesia. I didn't know I was going to get a nap during this whole thing. Your doctor will use a flexible tube to insert a tiny camera into your colon. That's not even my best side. To look for polyps or other problems as the tube is withdrawn. Ouch! The procedure takes about 20 to 30 minutes and there's a chance of perforation, bleeding, or infection. Yeah. All right, well, let's talk about a virtual colonoscopy. Now, it says here that the doctor does a CT scan of your abdomen and pelvis to create 3D images. Wow, that's pretty cool. And these images will show polyps and other abnormalities inside your colon without actually putting a camera in there. I like that idea. Now, there's less risk of tears, no sedation, and the patient can drive home by themselves afterwards. And the procedure takes only about 15 minutes. Think about all the fun things you can do in 15 minutes. Next Next up is the prep. It says the day before the test, no eating except for Jell-O and clear liquids. You'll need to drink your pre-screening laxative and be prepared to spend a few hours near the toilet. So during the virtual colonoscopy, the doctor slowly fills your colon with carbon dioxide, much like a balloon, right? Just like this. And again, during a regular or standard colonoscopy, the doctor will take a flexible 6-foot-long tube and insert it all the way into your colon with a scope on the end of it. Yeah, I think I made my decision. All right, well, today's the day. I've done my prep. I'm starving. I can't wait to get this over with. So I'll see you in 15 minutes. That was so easy. All I'm feeling, honestly, is just a little bit bloated from all the gas, but guess what? I guess I'll roll down the windows on the way home.
You know what? That didn't look so bad. When I had my colonoscopy, I had to stay close to home the day before and the day after.
Well, yeah, prep work is never fun, right? And I'm such a chicken, so it just seemed like the right way to go. But since I didn't have any other risk factors or anything like that, it was a perfect option for me, being minimally invasive.
But I have to ask you, so with my colonoscopy, we had cameras on the inside. The imaging was on the inside. But this is a CT scan, a CAT scan.
Right.
So the images come from the outside?
Exactly. The board-certified radiologist, who happens to be a medical doctor, too. A lot of people don't realize that.
Oh, wow.
They create 2D and 3D images of your entire colon and your pelvis. So they can see things from all different angles, flip it around, spin it around. They also, Erica, make a virtual fly-through of your colon. It's kind of like a video game for radiologists.
Well, that's crazy.
Yeah.
After my first colonoscopy, my doctor recommended that I get another colonoscopy in 3 years rather than 10 years. Mm-hmm. What did your doctor recommend after that?
Well, if you have no risk factors and everything's fine, it's like every 5 years. But if they do find something, you're going to come back sooner. But the good news is they can track any abnormalities or polyps and measure the size from screening to screening.
And that's the important thing, to get on a screening program. It's important to know that a colonoscopy, it's not a one-off thing. Right? You know,
exactly.
It's something you have to follow up with.
Well, that's basically the takeaway from this whole thing. You know, there's tests out there. You know, choose the one that works for you. And I always say the best test is the one that you're actually going to do.
I'm so glad you came by to see us today. Well, up next, virtual colonoscopies raise the bar for the patient experience. Welcome back. Virtual colonoscopy is proving to be a front runner in the battle to prevent colon cancer, providing patients and doctors with another powerful tool. Dr. Picard is one of the early pioneers and advocates of CT colonography and has published countless studies on the effectiveness. In fact, he literally wrote the textbooks.
Before I came to the University of Wisconsin, I was serving in the Navy and was one of the principal investigators of a multi-center Army-Navy trial that was eventually published in the New England Journal, where we compared virtual to conventional colonoscopy. And this was back now almost 17 years ago. And even at that time, we showed that VC was just as good, slightly better maybe at finding large polyps and cancers with a slightly higher sensitivity. It's a much more exact and precise way to detect and measure polyps. At colonoscopy, standard colonoscopy, they really have a hard time measuring things. Now they can get tissue and biopsy the lesion, so it remains the therapeutic gold standard by definition. Virtually anyone is an ideal candidate for VC screening once they hit the right age. We have the totally healthy, asymptomatic screening population at one end, and the sick, frail, or anticoagulated patients. And you know, CTC is actually ideal for all of those patients.
For women like Lisa, who has no family history of colon cancer, virtual colonoscopy was a welcome solution for her.
When I was 50, my doctor told me that it was time to have the dreaded colonoscopy. And so then he described to me an alternative experience, the virtual colonoscopy that is available, and I was very excited to be able to take part in that. It was really great for me because I was working and I didn't want to take 2 days off work. I just wanted to take a little amount as possible and to feel good the next day. And that part really appealed to me, to be able to go on with your day and not have any side effects afterwards. I didn't realize that it involved, you could see other parts of your body. And for me, my mom had an aneurysm at an early age. I think she was 50 years old and had to have surgery. So I always had in my back of my head that that could happen to me, and that was something that was found during my virtual colonoscopy, that I didn't have that. So that was a bonus, as well as the osteoporosis check where that came back with mine was normal, and my aunt had that. So that was huge for me to find out those two things. So I was really lucky to get this additional information about my health.
So because virtual colonoscopy is a CT scan, we see not only the colon but the other abdominal contents, including the bones. So we can actually provide for osteoporosis screening in a way that's equivalent to the DEXA or DXA scanning that many women and some men are undergoing separately. In addition, Medicare will cover an ultrasound to look for abdominal aortic aneurysms. Well, there's no need to do that if you've had a virtual, because it screens for that as well. So it's a 3-in-1 screening test, but it actually goes beyond that and detects cancers outside of the colon and actually screens for other diseases as well.
Former Professor Chuck completed his first virtual colonoscopy almost 13 years ago. Doctors did not find any polyps. However, what they found was life-altering.
So I scheduled my virtual colonoscopy a few days later after being recommended by my physician. And then when I got home, my primary care physician called and said, well, I've got some good news and some bad news. The good news is there are no signs of any polyps or any sign of cancerous tissue in your colon, so your colon looks in very good health. However, while they were looking at this, the virtual colonoscopy also imaged the rest of my abdomen, and they discovered that there were 2 aneurysms one in each of my iliac arteries, and the one iliac artery had distended to a 6th centimeter, about less than 1 inch in thickness, and so it was very significant. And he recommended very strongly that I talk to a cardiovascular surgeon very quickly. So within about 13 days of being diagnosed with the aneurysms, I was in the hospital getting my aneurysms repaired. One of the most common causes of unknown deaths to people in their 50s and 60s turns out to be aneurysms that we have no idea about. So here I was harboring a silent killer. Quite probably I would have died within a few months had they not discovered the aneurysms. It saved my life, and I would not be here today if it weren't for the discovery that the virtual colonoscopy made.
We might find, especially in a 50-year-old or older, that you have an aneurysm of your aorta. And out of those 11% of things that we find that might be more significant, only 3% of those were shown to need additional workup. So we've looked at why patients aren't screening more. It's not because the test isn't covered. If you have insurance, colorectal cancer screening is a covered service. That means it's covered without an out-of-pocket expense. We do need to talk about Medicare patients, specifically when we're discussing CT colonography. It is not covered for Medicare patients for screening purposes. Although the USPSTF vetted the test and said it's a great screening test, it should be offered as one of the options, a Medicare patient has to have a diagnostic CT colonography. They are not qualified to have screening colonography. And why is that? Why did CMS decide that in this patient population who tends to have more risk factors for invasive tests, that they would not cover this as a service? Because we've been talking to them extensively about this and trying to get them to approve this. We need to educate that there are options, and we just need to find the best option that matches with the patient.
I think we've shown beyond a shadow of a doubt that this test saves lives. It's as simple as that. There's no reason why this test shouldn't be alongside colonoscopy as an option for patients. People are dying of a disease that's almost entirely preventable, and that's just unacceptable.
If you're in the recommended age group, having questionable symptoms, or have a family history of colon cancer, do yourself a favor, talk to your doctor and schedule a colorectal cancer screening today. And remember, the best test for you is the one that you will take. For more information and to find screening centers near you, visit myctcolonography.com, and you can always find helpful links and resources at the Colorectal Cancer Alliance and our website, accesshealth.tv. See you next time.